Good afternoon to everyone. Please let me know if I'm audible to everyone.
Hello, ma'am. Yes, you are audible. Good afternoon.
Good afternoon. Thank you so much for letting me know. So, yes, thank you so much, doctors, for attending today's session. And it's a very important session because today we are going to discuss about our like MRCPCH Part 1 June 25 long course. I'm going to tell you that what is the structure, what is the content. Okay, just a second. Yeah, okay. All right. So, yes. So, let's get started with. All right. So, today actually the reason why I am here is because I want to tell you and make you understand about the structure and contents of our course, because we have a lot of videos available on our YouTube channel about what MRCPCH is, what are the parts, how many questions are there, and how you're going to prepare there. Like we have talked about this in a lot of videos present in our YouTube channel. If you want to see that and have any queries regarding that, you can go through that because they are very good videos and you can go through detail. But recently we are getting a lot of queries regarding our course, that what we are providing and how we are, what structure we have of our course, because obviously when a person wants to invest in something, so he has a right to know that what we are providing, will it benefit it not, okay, how they are going to help you. Okay, so it's very important for you to know that what we are providing. So that is why today I am here, to guide you that what is the structure and features of our course. All right, then after listening everything, you can decide whether to go with the course or not. So this is another thing. Basically, obviously that there are some students who are having a tough job, they are doing jobs, they are doing trainings, and they are working extended hours. Okay, so for those people, okay, so taking out time for study is difficult. All right, and I won't say that they like they cannot pass without the course, but it will make it easier for them. This exam MRCPCH is UK based. Okay, and we need to follow UK guidelines if you are preparing for this exam. And in our countries, a lot of, not, I'm not talking about UK but other countries, in other hospitals, UK guidelines are not has not been followed. So whatever they are practicing, that is different from the things which are asked in the exam. So they lack those things. So it is very important for them to keep themselves updated as per the UK guidelines. Okay, so that is the reason. Okay, so it will, what it will help them, how it will help them, that they will be able to um prepare themselves in a less time. Okay, and with the right pathway. Okay, so now talking about those students who are not working and at home because of their personal circumstances, because some of them are married, having children, they are not working, they do not have any clinical background knowledge. Okay, so for those students, I would say that they require detailed understanding and detailed conceptual studies for the pediatrics. Okay, because day by day the exam is getting complicated, and it's not the thing that you only learn the recalls and go to the exam. It's not about that at all. Okay, nowadays, like, they are changing the stem and everything. Okay, so for that you should know the basic things, the basic concepts, the basic knowledge of the topics. Okay, until and unless you don't know that, you will not be able to go through your exam or pass the exam. So that is very important thing. Okay, so after listening to me, after everything, you have to assess yourself. Okay, and see where you are standing and do you require any course or not. All right, now what how it will help, as I mentioned, that it will be easier for you. Why it is easier to study with the course rather than doing self study? It is because the course which we are doing actually provides you all things in ready. Okay, so we are providing each and everything. We are providing you notes, we are providing lectures, we are providing the combination of notes which is from the different books. Okay, so it will makes it easier for you to prepare yourself in less time. Okay, and it will also obviously preparation time will be less. So normally when people ask me that how much exam preparation is required, how much time is required for the exam preparation, so the ones who are not taking any course, I suggest them that at least you keep 3 to 4 months for one sub test. Okay, for one test, that means either you give FOP in 3 months or you give 2 3 months for TAS exam. Okay, because when you're studying by yourself, okay, so you have to study each and every book by yourself, you have to find out the guidelines by yourself, you have to solve the recalls by yourself, because a lot of mistakes are there in recalls. Okay, and you need to dig out the things, and it requires a lot of time. And the books, when I talk about books, there are multiple recommended books you have to go through. If you open the books, they are so huge, at the first instant you won't be able to get that what to focus on and what to not. Okay, so when you take any type of course, okay, so the things are very clear for you, that what you have to focus on, what is for TAS, what is for FOP, and it will reduce your preparation time, obviously. So I would say, if you if you are taking course, so it will take about 3 to 4 months for your preparation, and in that 3 to 4 months preparation, you are easily able to go through the FOP TAS exam combined. All right, so these are today's objectives. So we are going to talk about this. I'm going to tell you about structure, timings, everything, each and everything. And if you have any question at any point, you can stop me and ask me by opening your mic, or you can just put the questions in the chat box, and I will answer them. Okay, so coming to the course features now. So what we are providing, okay, so in our course, basically we are doing updated live lectures. Okay, so live sessions in each course. Now this is our fifth course, this is our fifth live course we are doing. And in each course we emphasize on live sessions of the systems. Now the reason behind the updated live session is because exam happens thrice a year. Okay, and each in each exam, the questions, the topics, we are having new questions, new topics. Exam is complicated. Okay, day by day it's being complicated. Okay, so for that reason we emphasize that that we do the live session, so that each of our session is updated. So every time we give a new course, okay, and the each lecture, the each chapter is basically updated, and we update them with the new topics, with the new questions, so all the information are updated. So this is the first thing why we emphasize on the live sessions. The second thing to do the live session is that when we come to the UK guidelines, okay, so UK guidelines keeps on changing. Whenever you open the UK guidelines, it's not the same. All right, so it's keep on changing. So when the question comes in the exam, okay, so if you talk about DKA, so I myself, I have seen a changes like thrice or four times in the DKA guidelines. It's something different given in the books. Okay, and the NIC guideline changes each time. Okay, so it was something else before 2017, it was something else at 2018, then it was something after 2022. Okay, so that is why when we do the live sessions, we keep an eye on an updated guideline, and we try to guide you according to that, because exam comes like that. All right, so that is why this is the main important reason we are doing the updated live session in each course. The second points, that we provide focus material covering all the recommended books. Okay, so coming to this point, basically a lot of student ask me, even those students who are enrolled in our course, that after lectures what they require to read. All right, so I want to tell you over here that lectures are enough to do. All right, because lectures are so designed that we have included all the recommended books. So all the NHS recommended book, all the RCPCH recommended books, we have combined together. So I would like to give you one example of one topic, such as I will talk about like celiac disease. Okay, so if we are giving lecture on a celiac disease, so that disease topic is taken from the illustrated textbooks. Also, it's taken from the SOP, which is the Science of Pediatric book. Also, it's taken from the clinical cases TAS, clinical cases FOP. So all the books are combined together and it forms one topic. So when you go through one topic of our lecture, so I am 100% sure that you do not require any other book to open, because it will provide all the necessary points, all the necessary important points, important topics, whatever is needed. Okay, so because we have been going through the exam scenarios since very long. Okay, so this is our because this is our fifth session now, so we know that what the exams are coming from. Okay, what they are mainly focused on. Okay, and during our lectures we are going to tell you that suppose if I thought that I was talking about celiac disease, so I will be telling like the introduction, brief introduction regarding that, and then I will come to the mechanism. Now, mechanism is something which will not be asked in FOP exam. It will be asked from the TAS book, and that is not present in the illustrated textbook. It will be present in the SOP book, because that is important for the TAS exam. Okay, and that is important for the clinical tests. Okay, so clinical cases of tests. So all this, like all the important points from those book will be gathered together and will be in one topic. Okay, so you will be having focused material covering all the recommended books. Okay, it will also cover the guidelines, it will also cover the NHS information leaflets, it will cover everything. I will come to the resources separately. I have made the separate slide for that. So if you have any question that what books, what resources, so I will come to that in detail. All right. Okay, so next point is past 6 year recall discussion. Okay, so apart from the live session, we are giving recall discussions as well. Okay, so recall discussions are like after every lecture you will be provided with the recall lectures. Okay, now we have formed our recall lectures in such a way that they are systemic wise. Like suppose if you are doing cardiology, after doing the cardiology lecture, we will be giving you the recalls of cardiology, and it will include past 6 years recalls, and that will be in detail. Okay, so each and everything will be discussed, like what, how to exclude the other options. Okay, and what is the answer, and how you're going to approach the answer, and how like after each explanation the topics will be provided, like how we are doing in the lecture. So whatever we have done in the lecture, it will be provided in the recall discussions as well, so that it will call as a revision. Okay, so we are providing the recall discussion as well. So this was the things which we are providing you as a lecture. Then you will be having a 24/7 guidance and assistant in a closed group. We have a WhatsApp group. Each time when we start a new session, okay, we make a WhatsApp group, which is a closed group, and students are very free to post any question over there. If even attending our lectures, even attending the recall sessions. Okay, if they have any question, if they don't understand anything, okay, so they can ask in our live sessions as well. But if not, because some of the students are there who prefer the recordings. Okay, so after watching the recording, if you have any question, so you can ask anytime. Okay, so we are all available on our session, on our group, to answer you anytime. So I have a question. Let me what a fee structure. Okay, so the fees, for the fee structure, basically you need to contact the admin. So admin will contact you directly. I will be mentioning you in the last about the contact details. So you can see over here below also the contact details, so they can tell you the fee structure. Okay, all right. Next, okay, so I was talking about the guidance. So we are very active. All right. We try to answer students promptly. I have one more colleague, Dr. Aksali, and she is also, very active. So we both try to answer promptly to the students and try as much as guidance we can give. All right. Not only the close group students, but we are there to help other students as well, because we have some free groups as well. And if they tag us and if they ask any guidance, my sometimes my inbox are totally full of questions, but I never see them, like whether they are the course students or they are from outside. We are free to answer anyone. All right. Then I would say that recording of each session is available. So we have a website, our own website, at which we have put our recordings available. So those are recordings you have a complete essays until you pass. Okay, so you can watch them as many time as you want. All right. And apart from that, the PDF available over there also, like as a notes. Okay, because recording you are not going to see again and again, because you need to learn the things from the notes. Because I say that you do not need to open any books. So PDF are available on the website. You can go and open the website and can open the PDF, and all the notes will be available to you. You can easily study from them. All right. So all these things are available until you pass. That means once you are subscribed to our course, okay, so you will be um, through there until you pass. God forbid if you didn't clear, but I am 100% sure that if you take the course, you won't fail, because we have very high success rate. Still, if you don't pass, okay, so you have the access until you are not clear. Okay, so until you pass, you have the access. You can go through multiple times as you want. Okay, and you can ask us multiple times whenever you want. So we are quite reachable. All right, so these are the course features. Now we are going to talk about the course schedule and the timings, that how we have uh, you know how we have structured the schedule and timings. Okay, so we have certain chapters which are the major chapters. Okay, and that includes the cardiology, nephrology, infection. Okay, we have let me tell you over here. Okay, so neurology, we have respiratory, GIT, infection, endocrinology, and nephrology. Okay, so these are some of the major chapters. So major chapters means, the major chapters are, those chapters which constitutes the large amount of your exam, because exam questions, comes 70%, 60 to 70% are from these chapters, and these are quite prolonged. Okay, so we have arrange these majors such that, because these are long chapters, so we have two lectures for majors. Okay, so we have two lectures for major system, and then we come to the minor chapters. So minor chapters are different type of chapters which are remaining one, which constitute 30% of your exam. So each lecture for each minor system, or each chapter, you can say. So that is also, we have more than 30 lectures. So you can see over here in this, that after nephrology, so we have growth. Okay, then we have ethics and safeguarding, then neonatology. Okay, hematology, oncology, emergency, psychiatry, genetics. Okay, and coming to the next one is the dermatology. So all these are basically the minor chapters which has one lecture. Now we are doing these lecture, we are trying to cover one chapter in 1 week. Okay, so like suppose if we are doing cardiology, so we are trying to finish that cardiology in 1 or 2 days. Okay, so that the remaining week is for you, so that you can go through other things also. Okay, so you can go through the recalls, you can go through the mock test. Okay, so you can go through that. So here I have mentioned about the major and minor chapters. Okay, so two lecture of each major and one lecture for each minor. All right, so each session approximately they are it's of 3 hours. Okay, so if we are talking about majors, so they have two lectures, so it's of 6 hours, like 3 hours for one session and 3 hours for another session, and that is on different dates. All right, then after we are done with the lectures. Okay, so we are going to provide you the recalls lecture. So recall session for each chapter covering previous 6 years with detailed explanation. So if I show you the schedule over here, so you can see over here. So suppose if we talk about part 1 and part 2, so we are starting our course on 15 Feb. All right, so 15 Feb is the first lecture, then leaving one day we have 17 Feb, so 2nd Feb as the annual lecture, which is the live lecture. Then you will be provided with the recall lecture. Okay, so you have to watch them. Then you can assess yourself by the mock test, cardiology mock test. So we have arranged some of the mock sub test, okay, after each chapter. Those are basically recall based only, but it's for your assessment, that how much you know, how much you have gained after your lecture, how much you have gained after watching the recall session. Okay, so it's for your assessment. So whole week will be of cardiology. Okay, you are going to take the lecture. Okay, you are going to watch the videos. Okay, you are going to learn about it. Okay, you have to learn the PPTs. Okay, and then you assess yourself. So in this way you are going to cover whole of the chapter in one week. Okay, and then after that week we will be doing another chapter, suppose neurology at 26, and neurology part 2 as 20 weeks, and again the recall session, then neurology mock test. So in such way, okay, you're going to cover one chapter one by one, and you will be preparing yourself for the exam in this way. All right, so these are some structure of our course. All right, so I have discussed a recall session. I have discussed about the self-assessment by mock sub-test, which is available after each chapter session. Then lastly, after all the lectures are done, okay, after all the chapters are done, in the end we provide you as a grand mock exam. Okay, and that grand mock exam is also recall based, basically, because exam is more like the recalls exam. Okay, so that is a grand mock exam. You are preparing yourself for your real exam. Okay, so just before attending the real exam, we prepare you to attend the grand mock exam, so that you get familiar with the things, you have time management and everything. Okay, so that's why that is the reason we have kept the grand mock exam. So if I show you over here our schedule, that it's starting from 15th of Feb. Okay, and we are ending our session over here. The last session is metabolic, which is 9 June. Okay, and after that, after 9 June, because exam is 22nd June. Okay, and then you will be provided with the grand mock exam. So at any time after 9 June you can take this mock exam, and you can assess yourself. Okay, so exam date is basically 22nd or 25th. Oh, I think, yeah, 25th June. All right, so you have ample of time after 9 June, all right, to basically revise yourself. All right, so we are finishing on 9 June, then you will be having 10 to 15 days to revise yourself and then go for exam. All right, okay, now this is the schedule, all of the schedule which I have discussed with you. Okay, now resources, of course. Okay, that what books we are using, what guidelines we are using. Okay, because a lot of people, as I already mentioned you, that a lot of people ask me that after lectures what should we read and what should we not. So the lectures are prepared and arranged so that we have combined all these things. Okay, so when we talk about FOP, foundation of practice, okay, so each topic is taken from the illustrated textbook of pediatrics, which is recommended book. Science of pediatrics, this science of pediatrics, is specific for the theory and science. Okay, but I would say that there are some questions which are directly asked from the science of pediatrics, and it's not present in the illustrated textbook. For each topic in our lecture, we have gone through each and every book, which are the recommended ones, so that we do not miss any point which is important for you to prepare the exam. If you go through the lectures, you will be 100%, you will be 100% prepared for the exam, and I'm sure about it. Okay, clinical cases, FOP. So each case, because cases, what we have in cases, we have the same topic in the cases. Okay, and same things are present over there, but there are some there are some points, okay, there are some explanations, okay, which will help you to solve the questions, and those are important, and which is not given in the books, okay, the normal books, which is the science of pediatrics or illiteracy textbook. So that is why cases are also very important. So we have taken extracts from the clinical cases also, okay, and we have put in the topic. So that is very important, okay. Then coming to the guidelines, guidelines are very important for the foundation of practice, which is FOB, okay. Many guidelines are there, okay, numerous guidelines are there in the exam questions, okay. So for that we have used the bedside pediatric guidelines, we have used the bedside neonatal guidelines, but I will tell you that these are not enough, okay. There are multiple questions, okay, they are asking you about each and everything, and that is not present in the pediatric bedside guidelines, that is not present in the bedside neonatal guidelines. We have to search a lot, okay. We have to take the guidelines from the NIC website, we have to take the guidelines from the NHS guidelines, from information leaflets. So we have searched and searched each and everything from these websites, and taken out all the extracts and put in the lecture. So you will be having 100% of material, all the focus material in the lectures. Then coming to the theory and science, so same for this as well. Theory and science is basically more towards everybody knows this, that theory and science is basically anatomy, embryology, mechanism, investigations. So these type of question comes in the theory and science, and for that you should know the basic, okay. So the basic, for the basic knowledge, we have used the science of pediatric books, okay. Then we have the clinical cases of tests, very beautiful cases are there, okay. So we have include that also. And USMLE first aid is step 1. So why I have kept the USMLE first aid step 1, because TAS has many questions regarding the pharmacology, okay. And pharmacology is very good in USMLE first aid step 1. If we see SOP, we do not have that much pharmacology in this, we do not have that much microbiology in this. So for microbiology and for the pharmacology, USMLE first aid we have used, okay, to make you understand more. All right. So one thing I want to mention here, that our lectures are in the combination of the FOP and TAS. Like suppose if we are doing one topic, and that topic will include all the material for the FOP also and TAS also. So during our teaching, we usually recommend the students, like mention them that this point is important for TAS, this point is important for FOP exam, okay. So that you can have an idea that what type of question is coming in TAS exam, what type of question is coming in FOP exam. So it will make easier for your preparation, because there are some students who are taking combined exam, okay. So for them it's very necessary to provide them material together, okay. And there are some students who are not taking exam combined, they are taking separately. So for them specifically, we tell that what points are important to go through in the theory and science, and what points are important to go through in foundation of practice. All right, so these were about the resources of our course. All right. Okay, now coming to in the last, that why to choose us, okay. Because I would say we have a very high success rate with very high scores. This is our 5th session, and even after our first course, we have a tremendous and amazing feedbacks, amazing results, okay. So some of them I have put over here. They usually pass like above 80s and 90s, okay. Obviously I cannot put all of the feedbacks and all of the results over here to show you, but if you go through our Facebook page, you will see like each session, like each course results are available over there, okay. And the feedbacks are also available over there. So you can see the feedbacks of our course, okay. So they clearly mention that what are our structure, and how we are going to like support you, how we are going to guide you, and they are very quite satisfied, like 100% satisfaction from our students. All right, so you can see all of these over here. So these are some of the good students, I can show you some of over here. Yes, so if you want to see the feedbacks, obviously, because when we are paying for something, we know we need to get satisfied from the things, okay. So for your satisfaction, you can go through the Facebook page and you can see the feedbacks, and everything, each and everything is spread over there. Be satisfied, okay, and then come to our course, inshallah. You will be happy. All right. Okay, so in the last, this is the numbers, contacts, you can go through if you want to register. Registration is open, and we are doing 4 months course now, starting from the 5th of Feb, ending at the 9th June. All right. So Dr. Aksali, one of my colleague, and me, okay, so both are doing this course. If you want to join, registrations are open. Our first lecture is on 5th Feb, inshallah. Okay, so let me know if you have any question after this. So we are done with the session today. So if you have any question, please ask me. Single session duration is approximately 3 hours. Yes, if you want to join for FOP, so you will be provided with the test also. You have to pay once, whether you are going for FOP exam or TAS exam. You do not need to pay separately. Yes, so each session recording will be there. Yeah, lectures are enough. So if I show you some of the over here, so they the feedbacks also says the same, that all the necessary topics and points from the SOP and illustrated books were covered in each their lecture, and detailed explanations were provided for those topics. Additionally, their lecture provided all the necessary guidelines. So if you see our feedbacks, so they are clearly mentioned that lectures are enough. um what you're talking about lengthy, like 3 hours you're talking about? So obviously, because when we talk about when we are talking about minor chapters, okay, so minor chapters are small, and they do not contain that much question. So that for that, I would say that it will end up like 2.5 and something, okay. But for majors, obviously, because that is a major part of your exam, so that's quite long, okay. So that is 3 hour session. Part one session, like if you talk about major, because I have two lectures, so part one will be of 3 hours, okay. Part two could be of some less, okay, so depending on topics, because now we are having more topics day by day, okay, and we want to give you and provide you 100%. So we do not want to minus something and keeping it short to keep it short, okay. So that is why, because we do in detail, we explain it in detail, so it takes time to explain. We cannot just read the PPT and go forward. Yes, so registration for course in Saudi Arabia and paying money. Yes, so our admin can help you regarding that. Okay, so I will ask them to help you. They will message you. So that is why, if yeah, like you cannot take a 3 hours lecture continuously, so recordings are always available, okay. So you can go through the recordings. 1 hour you can take, and then 1 hour you can take later on. It's not necessary that you take the lectures live. All right, for live sessions, we are putting the live sessions because we need to update the lectures. All right, if you cannot take the live lectures, it's okay, you can take the recordings. So lectures are both for FOP and TAS. It depends that how much you can cover. If you are taking course, Dr. Mohammed, so I would say you are capable of doing FOP and TAS both, okay. And if you are doing like on your basis, on your studies on your own, okay, then go one by one. Yes, recordings will be available on the same day. Yes, and queries will be answered in WhatsApp group. If you ask the questions in the live session, so it will be answered over there, okay. And if it's still, you watch the recordings, okay, and you have any queries, you can ask anytime, because we are running this course from so long, and none of the student had that problem. Yes, those are the live lectures. The live lectures are recorded each time, okay, and they are put on the website. each course, not that we are putting the recorded lectures from our previous session. No, it's not like that. Okay, so when we do our course, recent lecture, that is the recorded lecture we are providing you, not the previous one. Okay, any more questions? Okay, thank you so much. Okay, so I would like to tell you, like obviously because in minor chapters, we have only one session. Okay, so it's difficult to divide it into the FOP and TAS. All right, but when we talk about majors, okay, so in majors, when we have two lectures, so we have arranged our lecture in such a way that first lecture is for basics, okay, which is the TAS exam, and second lecture is for FOP. Okay, but there are certain topics in which we cannot divide these things. Suppose if we talk about certain disease, okay, if you are talking about certain disease, so that disease we cannot put in test session. All right, but there are some mechanism they ask you, so that mechanism obviously that will be included in test exam, and the features and investigation and management will be asked in FOP exam. Okay, so we cannot separate that topic into two. Okay, so that is the reason there are certain topics which are kept together for the FOP and TAS. Otherwise, when we talk about the major part 1 and major part 2, so major part 1 consists of mostly TAS, the embryology, the anatomy, okay, the histology, the pathology, so everything basically is in the first part. Okay, and after that, when we start with our diseases, so in the diseases side by side we keep on mentioning, now this point is important for TAS and this point is important for TAS. Okay, so that the students are familiar that what type of questions coming in the TAS and what type of questions coming in FOP. And then moreover, when you go through the recalls, because recalls lecture are different, like for FOP we have different and for TAS we have different, so you will be clearly seeing that what type of questions coming in FOP exam and what was type of question coming in TAS exam. All right. Okay, so there is a register for exam. Yeah, so there is a registration dates basically given in the website that we usually update each time when it is near. Okay, so you have to register in that time. Yes, so I think because previously we used to have EMQs, now we have best of five. Okay, so best of five is more easier because we have only four or five options in them. We do not need to select from the eight options. So EMQs were more difficult. So now the time they have shortened the period. Okay, and the questions they have increased is 100, but basically because they are BOF, they are easily doable. Okay, so the passing percentage is basically depends on each of the test. Okay, so it's not same for everyone, and it's not same every time. But you have to keep in mind that you have to score at least 65 and above. Between 60 to 70, you should be scoring 60 to 70 because usually the passing rate falls in that. Okay, so you can contact over here for the course information. All right. Okay. So done. Any more questions? Thank you so much. Okay. So I think I should leave now. All right. Thank you so much for attending the session. And if you wish, you can join our course. And if you have any queries, you can ask also. All right. Thank you so much.